As the number of COVID-19 cases continues to rise globally and right here in Guyana, we encourage everyone to practice social distancing and wash your hands thoroughly and frequently as we strive to stop the spread of the virus. This is InfoHub for Tuesday, April 7, 2020. We have lots to tell you. The Ministry of Public Health announced on Monday that 8 persons associated with Guyana's first coronavirus case have recovered after isolation.
Please note that 3 family members of the index case who tested positive had 2 post-isolation tests. Both tests for each of the 3 family members are negative.
Minister of Public Health, the Honorable Valda Lawrence, she was addressing the nation on Monday evening during the daily COVID-19 update. Guyana confirmed the cases as of Monday, April 6, stand at 31, while the total amount of deaths has moved to 5. The ministry in a release Monday evening said the deceased Derek Jysing, formerly of Region 4, passed away at the Georgetown Public Hospital Corporation on Monday evening. The Ministry of Public Health continues to urge all Guyanese that adherence to the health advisories and social distancing are paramount in the country's fight against the deadly disease. For InfoHub, Stacey Carmichael.
The government, in collaboration with private agencies, continue to ramp up efforts in fighting the spread of COVID-19. In keeping with this commitment, the Civil Defense Commission on Monday continued its distribution of relief hampers to vulnerable communities.
The exercise is part of the Commission's efforts to mitigate the impacts of the measures implemented to prevent the spread of the novel coronavirus. The exercise saw Rivers View in Region 4 and Danzig to Bath in Region 5 receiving hampers. Initial focus is being placed on the most vulnerable population. The CDC also committed to ensuring that everyone receives their supplies. The hampers consist of food and sanitation items. Monday also saw the activation of a working group to address Guyana's COVID-19 response. The group comprises several government ministries, the Guyana Police Force, Immigration, Transport and Harbors Department, Guyana Civil Aviation Authority, Guyana Defense Force, the Guyana Water Incorporated, and other key agencies. This meeting was called to establish sectoral roles and create an extensive mechanism to ensure the highest level of collaboration among all stakeholders is attained to further aid in preventing the spread of the coronavirus, enhance preparation and strengthen our local response to the outbreak in keeping with the national plan. Additionally, the Commission's efforts were on Tuesday morning boosted with several donations from members of the private sector. Sajurais Group Incorporated, David Prasad Investments Limited, and the Jagmohan family donated to the cause. The CDC welcomes all donations and reminds citizens who wish to make a contribution that they can do so at its head office at Thomas Lands between 9 hours and 15 hours daily, while cash and checks can be deposited to its Republic Bank account 963-565-19938. For InfoHub, Anara Khan.
In the news from GCOM, as the Guyana Elections Commission continues with its plan to undertake the national recount of votes cast at the March 2 general and regional elections, plans are also in place to request the return of the high-level CARICOM team.
Though not in a supervisory role, the Commission believes that the team's presence will give credibility to the process. GCOM Commissioner Vincent Alexander said Monday that the agency will be soliciting the return of members of the team who, after spending 4 days in Guyana last month, returned to their respective countries following the filing of an injunction against the initial recount.
The idea is to see if we can still get CARICOM involvement, not as supervising the count, but as a presence that can give some credibility and validation to what GCOM does.
Will the Commission be reaching out, or will requests be made for the Ministry of Foreign Affairs to reach out?
I think the Commission will be reaching out. Whether they do it through Foreign Affairs or directly is another matter, but I think the initiative comes from the Commission. We have decided today that our preference in terms of an external body to give some validation that it's CARICOM.
The elections body met on Monday to finalize the modalities for the recount. Chief Elections Officer Keith Lowenfield has been tasked with drafting the official document for the process.
Along with the recount of the ballots, we will be doing the normal things done at a polling station when you're counting. So all of the issues of reject ballots, frauds, of stamps not being put on the papers, all of those things will come up for review.
GCOM will be moving ahead with the national recount of votes on its own after the appeal court ruled on Sunday that it should not allow outside forces to interfere with its constitutionally mandated responsibility. President David Granger last month had requested from CARICOM's chair, the Honorable Mayor Motley, for the body to supervise a national recount of all votes cast in Guyana's March 2, 2020 general and regional elections. The head of state was seeking to bring to an end any doubts about the legitimacy of the results. For InfoHub, Alexis Rodney.
The 8th annual World Health Worker Week is being observed from April 5 through 11 under the theme Leaders on the Line. According to the World Health Organization, the theme highlights the need to provide greater leadership opportunities for frontline health workers, particularly women health workers, who make up more than 70% of the global health workforce. At the same time, this theme emphasizes how health workers often put themselves on the line, often at great personal risk to themselves and their families, to save and improve lives. WHO says the COVID-19 pandemic and other global emergencies demonstrate the heroic efforts health workers on the front lines make every day to keep their communities and the world healthy and safe. Frontline health workers are every country's first line in detecting, reporting, and responding to emerging threats like COVID-19. The Department of Public Information takes this opportunity to applaud the country's health workers as they work daily to protect the nation's people. We will be back after the break. Thanks for staying with us. Let us tell you that the Ministry of Social Protection's Sexual Offences and Domestic Violence Policy Unit is taking the necessary steps to address domestic violence cases amid COVID-19.
Manager of the Sexual Offences and Domestic Violence Policy Unit of the Ministry of Social Protection, Akila Doris, noted that during this time when the country is fighting the spread of COVID-19 and a curfew in effect, among other measures, women and girls may be at higher risk of violence, specifically in their homes. She pointed at some statistics.
Globally, 1 in 3 women experience violence at the hands of a partner, former partner, or relative at some point in their life. Within the Guyana context, Guyanese women experience intimate partner violence at significantly higher rates than the global average of 1 in 3 women.
She added that tension can increase due to several factors, including income uncertainty and other stress-related matters.
Perpetrators may use this opportunity and use restrictions due to the COVID-19 epidemic to exercise power and control over their partners to further reduce access to services, access to help, and psychosocial support from both formal and informal networks. Perpetrators may also restrict access to necessary items such as soap and other hygiene items, hand sanitizers, cleaning agents. Perpetrators may exert this control by spreading misinformation about the disease and even stigmatizing their partners.
According to Doris, persons who are most at risk during this time are persons with disabilities, those with chronic illnesses, older persons in need of care, institutionalized children or children without parental care, migrants, and refugees. Persons can contact the 24-hour helpline on 227-0206. For InfoHub, Ayana George.
Here now is a short video from the World Health Organization. Remember to do your part to ensure you do not put yourself at risk during this time. The World Health Organization is also advising that vaccines against pneumonia do not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against COVID-19, and the WHO is supporting their efforts. If you have a cough, fever, or difficulty breathing, seek medical care early, but call the hotline first. That's all for today. Connect with us on all of our social media platforms, including WhatsApp, Facebook, YouTube, and Instagram, as we bring you the latest and important news related to COVID-19 and much more. Also subscribe to our website at dpi.gov.gy. Your bridge and weather reports are up next. Goodbye for now.